Kelsey.
And I'm Jessica.
And we're the primary anterior teeth. I have the maxillary right central incisor E, maxillary right lateral incisor D, and maxillary right canine C.
And I have the mandibular right central incisor P, the mandibular right lateral incisor Q, and the mandibular right canine R.
For maxillary central incisor E, the eruption date is 8 to 12 months old. Fruit completion is 1.5 years old. Shedding age is 6 to 7 years old. It's the permanent spot for tooth number 8 in quadrant 1. And the DAQT is the primary right central incisor. The line angles on this tooth are the labio-incisal, lingual incisal, mesiolingual, distolingual. On the other side we have the distolabial and the mesiolabial. The point angles on this tooth are the mesiolingual incisal, mesiolabial incisal, distolingual incisal, and distolabial incisal. This crown's general features include a cingulum, an incisal ridge, a lingual fossa, mesial and distal marginal ridges. There's a more prominent cervical ridge than its permanent successor. The crown appears trapezoidal from facial and lingual, and triangular from its distal and mesial aspects. The specific features of this tooth is it appears wider mesiodistally than incisocervically, the opposite of its permanent successor. Its mesial and distal outlines are more rounded than its permanent tooth. The incisal outline is relatively straight but slopes to the distal with attrition. It does not have mamelons. The cingulum and marginal ridges on the lingual surface are more prominent than its permanent successor, and the lingual fossa is deeper. It has a short crown and a wide labiolingual measurement, causing the tooth to look very thick. There are rarely imbrications, hits, or developmental depressions. The height of contour from the labial and facial view is the incisal third. The height of contour on the proximal view is the cervical third. The mesial and distal contact are at the incisal third. The root features a single root, mostly straight with a slight distal curve. Distinguishing the features from left to right central incisor, the mesial CEJ curvature is more distinguished, and the incisal edge slopes distally slightly.
For the mandibular primary right central incisor, the eruption date, it's 6 to 10 months. The root completion is 1.5 years. The shedding age is 6 to 7 years, and this is permanent spot number 25. It's in quadrant 4, and the DAQT is primary right central incisor. The line angles on this tooth, we have the lingual incisal, the labial incisal, mesiolingual, mesiolabial, distolingual, and distolabial. The point angles on this tooth are distolingual incisal, distolabial incisal, mesiolingual incisal, mesiolabial incisal. Some of the specific features of this tooth: it has a shallow lingual fossa, and the tooth is very symmetrical. From the mesial aspect, this tooth is much wider labiolingually than its permanent replacement number 25. From a labial view, the crown appears wide compared to the crown of the permanent mandibular central incisor number 25. The crown also tapers evenly from the contact areas. The lingual surface appears smooth and tapers towards the prominent cingulum. The marginal ridges are less pronounced than those of the primary maxillary incisor. The incisal ridge is centered over the root from both the proximal and incisal views, and it's not as constricted at the CEJ proximally as the maxillary central incisor. The crown of the mandibular central incisor is more similar to the mandibular lateral incisor than any other tooth. The height of contour for this tooth from the labial and facial views is the incisal third. The proximal view, it's the cervical third. The mesial and distal contacts is the incisal third. The root features, it's a single, long, slender root, and the labial and lingual surfaces of the root are both rounded, and the proximal surfaces are slightly flattened. Distinguishing between left and right mandibular central incisors, the CEJ curvature on the mesial surface is greater than on the distal.
This is the primary maxillary lateral incisor. The eruption is 11 months old. Root completion is at 2 years old. Shedding age is 7 to 8 years old. It's a permanent spot for tooth number 7. In quadrant 1, DAQT is primary maxillary lateral incisor. The line angles on this tooth are the lingual incisal and the labioincisal, the mesiolingual, distolingual, the mesiolabial, and the distolabial. The point angles on this tooth are the mesiolingual incisal, the mesiolabial incisal, distolingual incisal, and distolabial incisal. General crown features of this tooth include the cingulum, the incisal ridge, the lingual fossa, mesio and distal marginal ridges. The crown appears trapezoidal from the facial and lingual and triangular from distal and mesial aspects. Similar to the central, but smaller in all dimensions. The lateral is smaller incisal-cervically rather than mesiodistally, which is the opposite of the central incisor. The incisal angles are more rounded than the central as well. The lateral's root is longer and skinnier with the same proportions as the central, and its apex is sharper. The height of contour for the labial and facial point of view is the incisal third, and from the proximal view is the cervical third. The root features a single root, mostly straight with a slight distal curve, and distinguishing from left to right in lateral incisor is the incisal edge slopes mesially.
This is the primary mandibular lateral incisor. The eruption dates are 10 to 16 months. Root completion is at 1.5 years old. Shedding age is 7 to 8 years old. It's the permanent spot for tooth 26. It's in quadrant 4, and the DAQT is primary mandibular lateral incisor. The line angles on this tooth are linguo-incisal, labial-incisal, mesiolabial, mesiolingual, distolingual, and distolabial. The point angles on this tooth are distolinguo-incisal, distolabial-incisal, mesiolingual-incisal, mesiolabial-incisal. The general crown features of this tooth: it has a cingulum, it has an incisal ridge, it has a lingual fossa, and it has mesial and distal marginal ridges. The specific features of this tooth: number Q, it's similar to tooth P, but slightly wider and longer. It has a more developed cingulum. and slightly deeper lingual fossa than number P. Its incisal ridge slopes distally. The disto-incisal angle is more rounded, as is the distal margin. From the incisal view, the crown is not as symmetrical as number P because the cingulum is offset towards the distal and has the same position as its permanent mandibular number 26. The height of contour from the labial and facial view is the incisal third. From the proximal view, it's the cervical third. The mesial and distal contact areas is the incisal third. The root features, it may have a distal curvature in the apical third and usually has a distal longitudinal groove. Distinguishing between the left and right mandibular lateral incisors, the incisal ridge slopes distally and the root may have a distal curvature and a distal longitudinal groove.
This is the primary right maxillary canine C. Eruption is 1.5 years old. Root completion is at 3¼ years old. Shedding age is at 10 to 12 years. Permanent spot for tooth number 6 in quadrant 1. In the DAQT, it's the primary maxillary right canine. The line angles on this tooth, this is the mesiolingual, this is the mesiolabial, this is the distolingual, this is the distolabial, this is the linguoincisal, and this is the labioincisal. The point angles for this tooth, this is the mesiolingual incisal, this is the mesiolabial incisal, this is the distolingual incisal, this is the distolabial incisal. The general crown features of this tooth include a cingulum, an incisal ridge, mesial and distal lingual fossa, and mesio and distal marginal ridges. The crown appears diamond-like from facial and lingual, and triangular from distal and mesial aspects. The crown features, it has a relatively longer and sharper cusp than its permanent successor when first erupted. The mesial and distal outline are both rounder in shape and greatly overhang the cervical line. The mesial slope is longer than the distal slope. The specific features of this tooth include it has a relatively longer and sharper cusp than its permanent successor when first erupted. The mesial and distal outline are both rounder in shape and greatly overhang the cervical line. The mesial slope is longer than the distal slope and the opposite of the mandibular and permanent canine. The cingulum is well developed, as are the lingual and marginal ridges. The lingual ridge extends from the cusp tip and divides the tooth into two shallow fossa. The tubercle is often present on the cingulum, extending from the cusp tip to the cingulum. The cusp tip is slightly offset to the distal. The root is twice as long as the crown and more slender than the permanent canine and is inclined more distally. The height of contour from the labial and facial view is the middle third. From the proximal view, it's the cervical third. The mesial and distal contact are in the middle third, and the root features a single root, mostly straight with a slight distal curve. Distinguishing from the left to right canine, the mesial slope is longer than the distal.
This is the primary mandibular right canine, R. The eruption period is 17 to 23 months. The root completion is 3.5 years. The shedding age is 9 to 12 years. The permanent spot is tooth 27. It's in quadrant 4, and the DAQT is primary mandibular right canine. The line angles for this tooth are labio-incisal, lingual-incisal, mesiolabial,
mesiolingual, distolabial, distolingual. The point angles on this tooth, we have the distolabial incisal, the distolingual incisal, the mesiolabial incisal, and the mesiolingual incisal. For the general crown features, we have a cingulum, as well as two incisal ridges. We have a lingual fossa, two of them as well, and we have mesial and distal marginal ridges. For the specific features, it resembles the permanent mandibular canine, but is much smaller labiolingually. For the specific features, this tooth resembles the permanent mandibular canine, but is much smaller labiolingually. The distal cusp slope is much longer than the mesial cusp slope, as is the permanent mandibular canine. The lingual surface is smoother than the permanent number 27 and has shallow lingual fossa. The incisal ridge is straight and centered over the crown labiolingually. The height of contour for this tooth from the labial and facial views is the incisal third. From the proximal view, it's the cervical third. The mesial and distal contacts is the incisal third. The root features, it has a long, narrow root, almost twice the length of the crown, although it is shorter and more tapered than the primary maxillary canine. The distinguishing features between left and right mandibular canine is that the distal cusp slope is longer than the mesial cusp slope, and the root curves distally.
When a primary tooth falls out and leaves a space open, the teeth on both sides will want to fill that space and won't leave room for the permanent tooth to erupt, so a spacer will be put in place to keep the teeth from migrating over. Crowding and occlusion complications can occur in permanent dentition due to carious primary teeth being extracted instead of repaired. For early childhood caries, infections and discomfort are more common due to thinner enamel and dentin, which increases the risk of endodontic complications. A larger pulp cavity increases the risk of pulpal exposure during cavity preparation.
I didn't hear what you said.
And 3, 2.
Thanks for watching.